Hello, everyone, and welcome to one of our 11 Together to Goal Plank Mentor webcasts. Today we'll be hearing from Dr. Ray Ann Williams of Health Partners Care Group. Dr. Williams is the Plank Mentor for the Build an Accountable Diabetes Team Campaign Plank. Dr. Williams, thank you so much for joining us today.
Yes, thank you for the invitation.
Tell us a little bit about you and your organization.
Yes, I'd be happy to. I'm with Health Partners. We are based in Minneapolis, Minnesota. We are a large integrated care delivery system with over 50 clinic sites. We care for patients in Minneapolis, St. Paul, Minnesota, as well as Western Wisconsin and the surrounding communities. We have over 1 million patients that we care for in our system and over 45,000 of those patients that have diabetes. I'm an internist with Health Partners and have been with the organization for 28 years. I have responsibilities as the department chair, as one of the regional medical directors working with 11 of our clinic sites, and have done work with our organization over the last 15 years on diabetes improvement and care team optimization.
Great. So tell us a little bit about how you built an accountable diabetes team at Health Partners.
Yes. We started our work on care team redesign approximately 15 years ago. We created what we have called care model process, or CMP for short. CMP was created by our care teams, and CMP is a standardized set of workflows that we use across our sites so that the care teams know their work, the tasks that are assigned to them, and when they will occur within the visit cycle. We created it with 3 pilot sites initially, and those workflows were refined at those 3 pilot sites and then spread across the organization. Like I said, this started about 15 years ago, and we've continued that work with improvement over the last 15 years and refining those workflows and taking feedback from our care teams to make these workflows even more efficient. The workflows work for all of our patients, and then for those high-risk clinical conditions or frequent clinical conditions such as diabetes, we have a clinical module that focuses on the workflow specific to those diagnoses. So we have defined what needs to be done, when it needs to be done, and whose responsibility it is to carry out those tasks within the visit cycle. The accountability piece is something that we do in several ways. We're very transparent with our health outcomes, so we share our health outcomes with our care teams and all those delivering care, so they know where there is opportunity to improve. We also share what we call care team scorecards, and we have quarterly scorecard meetings with our care teams, and that's with the care team made up of the clinician and the rooming staff, as well as the site leadership, to again identify where there's opportunity to improve.
Great. So how did you take into consideration Health Partners' culture as you built your team?
Yeah, that's a great question. We were very intentional about culture. When we started this improvement work about 15 years ago, at the same time we were working to standardize our workflows, we also had conversations across the organization about culture and the culture that we were looking to build and foster. We included clinicians in those conversations and created what we first described as the physician compact. When we combined with Park Nicollet, another large medical group in our community 6 years ago, we took time, again, stepped back and had conversations and gave all clinicians the opportunity to participate in those conversations and, again, define the culture that we were looking to build. So we were very intentional about building a culture of partnership and a culture of improvement.
Great. Tell us about any challenges you may have encountered in this process and how you overcame that.
Well, as you can imagine, when you have a large group of physicians, there are a lot of different workflows that have worked for them for many years. And so when you are working to standardize workflows, it means that people are going to have to change the way they do their work. And so when we did this work or started this work 15 years ago, we knew that was going to be an issue, that some people were going to feel that they were giving up a very efficient way of doing their work. We tried to include our physicians, clinicians as much as possible in this improvement work and acknowledge that this was hard. Also, as we did this improvement work, we encouraged feedback. And so when we first trained the workflows, we were very, very deliberate about asking for feedback and asking for improvement, and we continue to do so because we know that these workflows aren't perfect. We know that they work well, and we also know that there may well be better ways to do things. And so we ask for the input of the clinicians and the support staff that are using these workflows so that we can continue to improve. We have what we call a care model process oversight team that takes all the feedback after we've trained the workflows, and they review that feedback and consider it when they're doing the next round of improvement.
Wonderful. So the last question we have for you here today is, what is one piece of advice you have for an organization that is tackling this campaign plank?
The advice I would give is to, as much as possible, lead with the why. When our care teams understand the value of team-based care and that we can improve better together and try to avoid the silos or the islands of excellence, we do much better job of getting our patients to goal. I think the other thing with the why is helping understand why getting our patients to optimal diabetes care goal, reaching all the goals, is important, and that in the end it results in fewer cases of diabetes, eye disease, amputations, or myocardial infarctions. So it really makes a big difference for our patients.
Great. Well, thank you so much, Dr. Williams, for your time with us today. We appreciate you sharing your insights and experience on this campaign plank. And just a reminder to all of our fellow participants, if you'd like to contact Dr. Williams to discuss implementation of the Build an Accountable Diabetes Team campaign plank at your organization, please email t2gmentor@amga.org. Again, check out our remaining Together to Goal Plank Mentor webcasts on our website to discover what other experts have done to improve diabetes care across the country.